The landmarks for the incision are the distal diaphysis of the tibia, the medial malleolus, and the metatarsal bones. The angle for the pantarsal arthrodesis is predetermined by observing the normal standing angle of the tarsus in the individual patient. The angle is usually between 135 and 145 degrees. The foam is incised on the medial aspect of the tarsal joint. The foam is retracted to expose the cranial surfaces of the distal one-third of the tibia, the tarsal joint, and the proximal half of the third metatarsal bone. The medial collateral ligament is cut to gain access to the joint surfaces. In the clinical case, the articular cartilage of the talocrural joint surfaces, the proximal intertarsal joint surfaces, and the tarso-metatarsal joint surfaces are thoroughly removed with a bone curette or high-speed burr following the contours of the bone ends. Cancellous bone is harvested from a suitable site. The graft is placed within the prepared joints, and additional graft may be added after the plate is secured. A 12-hole 3.5 DCP is positioned. It's been pre-contoured to provide 140 degrees of joint angle to the cranial surface of the tibia, the talus, the central tarsal bone, and the third metatarsal bone. The acute bend in the plate is positioned over the neck of the talus. There should be enough plate holes for a minimum of 5 screws in the tibia and 3 screws in the metatarsal bone. The level of the distal metatarsal plate screw is marked. The plate is removed, and the drill is centered on the metatarsal bone to prepare the first screw hole. The plate is secured with 3 screws in the metatarsal bone. The plate and joint alignment are checked, and the plate is secured to the tibia. The remaining plate holes are filled. At least 2 plate screws should penetrate the calcaneus to secure the joint. The axial alignment of the limb and the angle of the arthrodesis are critically observed.